Okay, hello everyone. My name is Brian Thorne. I am the manager of the Lift Therapy department in the Lift Wellness Center downtown. Just wanted to come to you today. We're going to talk about knee pain today, fixing it from the ground up. So we're going to look at different aspects of knee pain and what we all struggle with. From time to time, it's a pretty common area of pain that we deal with in physical therapy. And also talk about some ways that physical therapy can help, or maybe your doctor can help. So hopefully that will help you solve some problems you may be having with your knees, or hopefully you won't have, but if you do, you'll have some tools in your toolbox, so to speak, to be able to combat these problems and hopefully have a successful, well, and happy life in the future. So let's take a look at the slide presentation here on the wall. There's several different types of knee pain, several different areas talk about. We all struggle with from time to time. Here you'll see some X-rays here on the left top of the screen of a normal knee and a good joint space that you have here. On this side we have a narrow joint space. You can kind of see the knee is angled slightly, not perfectly level. This knee has good cartilage, good spacing, which shows up as space in the X-ray. Whereas over here on this side, it's sort of difficult to see. There's a bone spur here on this side, but you can see the knee is angled. One space is closer than the other. This is what we call an arthritic knee. Come on in and join us. There's a sign-in sheet right here. Like to sign in? Just
I didn't see anybody.
come on in. Yeah, we're just videotaping also the presentation. I'm going to keep moving ahead here, but just make yourself at home. So if you have some areas of knee pain, this will be an arthritic knee here. And this is a picture here in the middle where the knee has been replaced. You can see the prosthesis, if you will, inside the knee, how far down the bone it goes. It creates a new joint space, nice and lined up appropriately there. Here's a side view. You can kind of see the new knee surfaces here, and the kneecap out here out front, and the prosthesis going down into the tibia. There's some other areas of injury that we see a lot of times in the clinic in physical therapy. This is showing a knee bent on this picture. Here's a close-up on this side. And if you look in the middle, you'll see some what we call, they're ligaments, they're cruciate ligaments, the anterior cruciate ligament and posterior cruciate ligament. The anterior is one of the more common ones that's torn, called the ACL. You may hear an ACL tear or an injury. You can see how that ligament there is cross-sectioned or torn there in that picture. Here's a real tight close-up here of a complete tear of the ACL, very common in soccer or contact sports such as football that we're in right now, this time of year. There's a partial tear up there, but if it's a significant enough tear, they will not heal back on their own. You'll need probably surgery to help fix that. There are some cases where rehab can help avoid surgery. Here's an arthroscopic surgery picture here of the femur, the bone here, and the ACL ligament up close, real tight view of a good, normal, intact ACL ligament. The picture over here is just showing some arthritic spurs and a new knee surface, kind of cartoon drawing, if you will. But moving along, what we're all looking for is just healthy knees. We're looking for a way to be well, a way to enjoy our lifestyles throughout many parts of our life here. There's children here as they grow up and be active, kind of more growing up in the middle age and more into adulthood here. We all want to be active and enjoy, have good muscle tone, good strength, good flexibility, ways to just be independent. And what we're seeing in therapy is we do a lot of fall screening. That seems to be, seems to be a major topic, hot button for our population that's aging. We have some screening tools, some equipment that helps us identify folks at risk of falls, and that's one of the more common ways that people end up having their health decline is to fall and have an injury, a sprain or strain. Come on in and join us. A sprain or strain or a fracture or need surgery. So if we could prevent that, we've done a good job in therapy also. Some common complaints of knee pain that we see in the clinic are pain around the kneecap, or what we call the patella. different areas. Joint line pain, which is right at the bend of the knee in the front or back. Catching or locking complaints. Cartilage tears that may need surgery or therapy could help. We'll talk more about that in a minute. Grinding or a cogwheel. If someone has a lot of cartilage gone in the knee, there's no cushion padding, you can hear the knee when they move. It'll sound like a grinding, almost like a grinding sound, to where there's not much cartilage or support left in the knee. May require a knee replacement if the pain is too bad and their condition declines. Achy pain, a lot of times arthritic type pain, or sharp pain, more indicative of acute injury. Pain with squatting, pain with twisting. Could be different parts of muscle, tendon, or cartilage areas that kind of cue us in. If you tell us what activity hurts, a lot of times we can help you identify what structure may be involved. Pushing or pulling, they may have swelling, redness, or it may feel hot to the touch at the joint. It may feel unstable or giving way. You're walking along the stairs, your knee kind of collapses or gives out. That's another complaint that we see. And we'll talk about ways to intervene some of those problems. Some of the diagnoses you may get with knee pain is OA, which is osteoarthritis, which is the wear and tear we all get at varying degrees. And then the other general category would be RA, rheumatoid arthritis, where the body's immune system kind of attacks the joint linings and causes them to deteriorate. Not everybody would have that. Tendonitis is another one where the muscle, that's just the place where the muscle attaches to the bone. The tendon itself becomes inflamed. It gets little microscopic tears in it. That's where you get the sharp pain. And a lot of times just rest or ice or anti-inflammatory medication can help that. But if it goes on for a long time, a therapist or therapist can help you identify what it is causing that and correct it so it doesn't come back. Bursitis, a little fluid-filled pouch that helps lubricate joint structures moving. There's some around the kneecap. It helps the bone and tendon and muscle flow naturally and smoothly. If that little bursa becomes inflamed, of course, they call it bursitis. Cartilage tears, meniscal tears. There's two different main types of cartilage in the knee. The hyaline cartilage that's grown onto the joint surfaces where they connect. That's one type of cartilage. As it wears down farther and farther, if it wears down to nothing, where they say bone on bone, we're probably going to need a joint replacement surgery at that point. But then there's another type of cartilage that's called the meniscus. The little rings of cartilage that help cushion the knee, that help with shock absorption on the knee. Sometimes people will tear small parts of that, and it'll get inflamed for a while. And just because you have a cartilage tear in the meniscus doesn't mean you have to have surgery. If it calms down, you get the pain, swelling, inflammation to calm down, it can still be torn. If it's not in the way of the joint and doesn't irritate the joint lining, then there's no harm in letting it remain the way it is. If the tear is bad enough, it'll catch or lock, or it'll remain swollen. It'll stay warm. There'll be a lot of fluid in the joint. You can kind of wish the fluid around, swish it back and forth, left and right. And that, if you leave that in the knee too long, it can help speed up the deteriorating process of the knee joint. So if it's becoming, red hot, swollen, a lot of fluid in there, catching, you just can't walk, you're limping, other things are hurting because you're limping, you probably are going to need to touch base with the orthopedic doctor to see if it might require smoothing that out, an arthroscopic procedure. Okay, patellofemoral syndrome, that's just basically the patella is the kneecap. It needs to move up and down the knee. As the knee bends, it needs to go up and down its groove right in the midline. If it's off one way or the other, left, right, forward or back, it'll rub irregularly, and a therapist can help you strengthen or stretch the appropriate muscle groups to help prevent that. And some other ligaments, there's kind of four main ligaments there, the knee. There's another one we won't talk about today that's kind of new, a little small ligament. But the ACL, the PCL, the MCL, and the LCL, basically, that's 4 ligaments that surround the knee on left and right sides of it, and also 2 of them are in the middle. It helps stabilize the knee so it doesn't remove from where it should be. Helps to hold it so it can bend naturally and not bend in ways it shouldn't bend. So that's great importance, these ligaments. Some people, like I said, the one you hear about the most probably is the ACL. If you tear the ACL, we get the question a lot, do you have to have surgery? No, you don't have to have surgery if you tear your ACL, although your knee will kind of feel unstable. It'll feel like it kind of wobbles or slides when you change directions, if you turn a corner quickly, or if you're even more active, walking in a straight line or even real light jogging is probably not going to bother you. But if you do some heavier running or heavier jogging or something, a sport or an activity that requires you to change directions frequently, sooner or later, if you don't have an ACL, that knee will probably collapse and may tear more cartilage, may cause more damage in the knee. So it's just a good conversation to have to see how active you are and what you're looking for as far as your goals. A therapist can help you and an orthopedic doctor decide if surgery is right or not, or just therapy is right for you. MCL is another one that's on the inside of the knee that people will just kind of turn their knee, kind of sprain it inside. That one kind of heals on its own. That's good. A lot of times will not require surgery. PCL is pretty rare inside the knee. LCL is pretty rare. That's the lateral collateral ligament. It's pretty strong. Those two are pretty rare. Let's see, osteochondral defects. Basically, the end, I keep holding my hands like this. I'm just saying if the knee joint was here and you see it bending back and forth like that, the cartilage, the hyaline cartilage that touches itself there, we talked about wearing down to bone, the cartilage that's there, sometimes people will sprain their knee or land hard on the knee and it'll impact the knee joint. And that cartilage that touches each other, that's grown onto the bone surface itself, can get an osteochondral defect on it. Sometimes a deep bruise can cause that cartilage to deteriorate, die, it'll kind of die off, and it'll look like a crater in the moon. And if it's a place where the knee needs to be able to touch itself and slide in a good, safe, clean, slippery motion, it may require an osteochondral defect surgery to where sometimes they can drill little holes in there and smooth it off and try to get the body almost bleed out and produce more cartilage in that area. Sometimes that works. Sometimes it helps. It kind of scars over there. Other times they can almost take a cookie cutter approach and kind of ream out that defect, almost like that cookie cutting. You hit the dough and cut the piece of dough and take a piece out. That's what they do in that defect. It may be irregular, jagged edges, but when they imprint it and take it out, it's nice clean edges, and they can take some donor bone and cartilage from either another part of your knee, match it up, cut it out perfectly, and stick it in that little hole, put a pin in it to hold it, and it'll be non-weight bearing probably 4 weeks at least, if not 6 to 8 weeks. Let that heal. Sometimes that's really nice when it does work, because it just covers that defect. It's nice and smooth again. And they've even got some donor bone and cartilage. Sometimes I've heard, I know in Birmingham they've done some of those surgeries. There's a guy here in Jackson that had a successful surgery a few years ago. He had a big defect. He'd fallen, injured his knee really bad, had the ligaments repaired, had a big defect in his cartilage, and they took some donor bone and cartilage and just took a plug. They had it in the tissue bank and down in Alabama there, and it matched it up, trimmed it out perfectly, and put it right in his area there, pinned it. After about 2 months, he could start walking on it again. So he's doing great. He's back at work, independent, leading a good, healthy, independent life. Otherwise, he was going to be on crutches or a brace or a wheelchair the rest of his life if he didn't have that done, or be facing a total joint replacement as well. Bone bruises, we talked about that. Fractures, dislocations. It just depends on, every fracture is different. It just depends on how bad it is. Sometimes they heal on their own. Sometimes they require surgery. Sometimes they might require a joint replacement, depending on how severe it is. Some other causes of knee pain that we have. Concrete is we get a lot of folks in therapy from concrete, working on concrete several hours. It'd be nice if we all worked on padded carpet or grass. And grass is very padded, if you will. But we had the mistake of one office we were in for a few years, maybe about 5 years. We had carpeted. We thought it'd be fine with carpet, but there was no pad. We didn't realize there was no pad under the carpet. And then all my staff, we had about 5 or 6 people that ended up with plantar fasciitis and knee pain and back pain. Just we didn't realize we were standing on concrete all day, which I know we struggle with that in some buildings that we have. And you know, if you don't have that luxury of having padded carpet, a good padded shoe and or orthotic, which we'll talk about more in just a minute, and arch support can really, really help decrease some of that trauma and impact on your joints. Posture is very important. Basically, if you don't remember anything else I say, posture, every joint works best in a certain anatomical neutral position. If we get out of that neutral position, the knees angled in, the back slumped, structures rub on parts of themselves that are not really made to do that, and they'll wear out faster, and the body does not work as efficiently. So it takes more energy and causes you a problem down the road. Things will wear out faster if you have poor posture. And we'll see some pictures in just a moment. Other causes is just over time wear and tear that we have. Posture may affect that as well. Repetitive stress, if there's something, you know, if you're running errands all day and you take the stairs every day, running up and down stairs can be rough on your knees if you're doing that a whole lot. Or working down at the lift, the wellness center will have some runners that they're increasing their mileage. Maybe they were doing 5Ks before and not having a problem, and they would like to do a half marathon or a full marathon. I have not chosen to do a half or a full. Those distances are pretty scary to me. 13 miles, I can't imagine why I want to run 13 miles. Anyway, or even worse than that, 26. But we'll see a lot of repetitive, you can imagine the repetitive stresses on certain parts of the joints, especially the knees. And sometimes we can alter their positions of their knees by touching base here on posture and also getting them in the appropriate orthotic, which can help stand them up properly, realign them, get them in midline, make their foot hit the ground properly, which can make their knee hit the ground in a correct manner, which can help their hips and back and so on, kind of fixing it from the ground up. Muscle imbalances in therapy, when we evaluate someone, we kind of check all their muscle groups to try to see, you know, just if you're here for an ankle sprain, you know, we'll still kind of check your muscles on your knee and your hip, see if things are lined up properly. The same is true if you're there for a knee injury. We'll check certainly your quadricep muscle in the front of your thigh, your hamstring muscle on the back, but also some of those deep internal hip muscle strength. If there's a proximal problem here at the waist, that's going to affect the way your body moves when you walk. It's going to put abnormal stresses on your knee. Again, if your foot and ankle's not hitting the ground properly, it will torque your knee, it'll turn your knee in, it'll create some angled stresses that should not be there. And we'll help try to line that up and strengthen the right muscle groups or stretch the appropriate muscle groups in therapy. Help somebody recover from that appropriately. Trauma, obviously, car accidents, falls, all types of different trauma can cause knee pain. Tightness, someone may have, we've seen folks come in therapy and, all right, on evaluation day, let's see how far you can raise that leg. And we'll lay them down, raise their leg up, check their flexibility, and one leg may do, okay, it looks pretty good. And then grab the other leg and pull it up to hamstring length, and it's like, oh, halfway up, it gets stuck. Well, what happened there? Well, when I was, 10 years ago, I had this fall, and I'll kind of go into this story, and say, oh, that makes sense. So now we've got an imbalance, so when they're walking, their muscle length may not stretch and move appropriately. So they may have a few thousand steps a day where they're, limping or putting stress more on one side than the other. The body's not moving the same left and right. One side may get more stress than the other. And in therapy evaluation, we'll try to identify those problems that someone might have uniquely to them based on their life history. Abnormal walking and running, we kind of talked about that a little bit, trying to identify those positions. How things are wearing on your shoes. Is it the inside of your shoes wearing out, the outside of your shoes wearing out? They'll just kind of look at the bottom of your shoe a lot of times and just watch you walk in the office, in the clinic, see how your foot position is and how that affects the rest of your body. Here's a side view here about posture. Swayback, lordosis, fancy words for basically not being in good posture, straight up and down. You can be head forward, slumped at the top of the shoulders, arched too much in the low back, or flat in the low back. And all that affects, depending on the position of this body weight, and all that affects the stresses on the knee as well. You can kind of see that from this picture too. If someone has a curvature looking front to back of the spine, you can see how the weight would be shifted more on one side versus the other, depending on which way that they are shifted. Leg length has a part to do with that as well, to which your therapist should check that upon evaluation too, to see if there's a leg length problem. As far as our gait analysis, just wanted to see if I can get this to pull up. It's a little picture of how somebody walks and runs. We'll see if we can get this to pull up. If it doesn't, that's okay. We'll try to skip this ad, whatever this commercial is, real quick.
In the average test drive, you learn about the car.
Oh, that's Pandora.
But what if your test drive was a little less everyday? You'd test the performance, learn about the technology and design.
It all starts with a vision of what a vehicle could be.
Meet the people who built it, and then go further. With a good test drive, you want to take it another mile.
I think I took a wrong turn in Albuquerque.
We went another few thousand.
You can see here on the picture, somebody on a treadmill. These ankles should be lined up perfectly when the heels are hitting the ground. And what we see there is the ankles are falling inward. All right. Let's see here. There we go. So if you look at that ankle, you can kind of tell, wait a minute, that don't look right. This should be straight. This portion of the ankle should not be bulging out to the inside. So there's a lot of stress moving to the inside portion of this person's body. And that torques, it twists this entire bone here, going up to the knee, and causes the knee to collapse to the inside as well. And that's just one example of how we would look at how somebody is walking, how somebody is running. And a therapist would try to help you identify that and correct that. Orthotics that we put in your shoe, we can heat mold those to you, custom mold those to you, and we can help align that and solve that problem, hopefully prevent your pain. Here's what I was talking about. Here's normal up and down here, the bone alignment. Here we have what you might hear, it's a varus stress or bow-leggedness. Someone's bow-legged. That's a generic layman's term for it. Knees curving out. You can kind of see where they're touching here, having abnormal stresses from one side versus the other. And then here, knock knees or valgus stress. The opposite is true. Different parts of the knee touch each other and rub differently. You can see some real life pictures here of how you can see abnormal wear and tear on the knee. We would try to line that up with orthotics and or therapy, but probably orthotics would be the best. Now, severe cases like this, therapy is not going to correct that. That person way down the road would probably have to have a knee joint replacement, and they have several tools that can help shave this off and change the angle and line it up quite a bit. I'm not sure the exact angle that they can correct, but I've seen some, 15, 20 degrees off that they've done some great work with these days. Kind of about to run out of time here. Just don't want to beat a dead horse, so to speak, but you can kind of see here the whole topic we're talking about, fixing knee pain from the ground up. This is somebody who pronates too much, so their feet fall inward too much towards flat-footedness. Here's one that's the opposite is true. Their feet roll out too much. Here's one in normal, neutral alignment. That should help take stress off their knees right there. And like I said, we have the orthotics. We can heat mold those, fit them to your shoes. You change them in and out your shoes. You can come see a therapist directly. You don't have to have a physician's referral in many cases, although we do work very closely with the physicians. If we think you need more follow-up with a doctor, we'll help you find one. and help you get in an appointment to see a doctor if we think you need that. But it could be something as simple as fixing a custom-made heat-molded orthotic that we have at several of our Sports Plus offices, and I'm at the Lift Therapy office as well. We have them there downtown at the Wellness Center too. I think we kind of touched on all these here about how therapy can help, checking on your posture, all your strength and flexibility, make sure it's all balanced. The range of motion, how you're moving everything. Your gait is how you walk. Look at your shoes. Look at your daily habits and stresses that you have. The way the pain presents, is it sharp, dull, achy, throbbing? That kind of leads us into finding what structures are involved and the appropriate treatment. Therapy, I'll just touch on here, heat and ice, ultrasound treatments. We can put anti-inflammatories in the ultrasound with a doctor's order. This is ontophoresis. That's just using anti-inflammatories penetrating through using electricity we can use in therapy. Tissue, finding tissue mobilizations and kneecap, patellar mobilizations to help line up structures better in therapy. Very specific stretches to find tight muscle groups to get those to the appropriate lengths. Site specific, we find the weak culprit of the muscle groups, give you the right exercise to help get you back where you need to be. We have electrical stimulation and some other machines we can plug into your muscles to show us, is a muscle working appropriately? What muscle is not firing correctly? We can correct that. Patellar taping, gait and posture we talked about. We can help put tape on the skin and pull structures, muscles, take pressure off certain structures, add pressure to other areas to help balance it out. Orthotics we talked about. MLD is just some swelling edema therapists that we have. Lastly, kind of finishing up here, your doctor may recommend therapy for part of your treatment. Anti-inflammatories, cortisone shots, bracing, very simple bracing. The body can heal itself when it's braced appropriately sometimes after an injury. Platelet-rich plasma injections, harvesting your own body's platelets, put them in a centrifuge and spinning them, and injecting those back into an injured site that's kind of a chronic site. There's been some studies show that helps in some cases, helps speed up the healing in an injured area. The Synvisc injections, it's an injection that's almost like a lubricating type material that may, if someone's worn through their cartilage, may buy them some time. They say around 6 months or so. It's not proven to work in every case, but can help possibly put off some knee joint replacement surgery. Autologous chondrocyte implantation, basically they try to harvest some of your cartilage cells. Your body's constantly breaking down and producing cartilage. They'll try to harvest an area that doesn't put weight on it much, an area that doesn't have weight bearing, and they'll grow that in vitro and put it back into surgically in an area that's damaged in your body. There have been some studies show that's been helpful. Surgery, of course we talked about some surgeries, and of course exercise, appropriate exercise can really help someone. That's pretty much all the time we have for this presentation. If anybody has any questions, feel free to stop me after the presentation today, or you can get in touch with me at the Lift Wellness Center. Again, my name is Brian Thorne. You can find me on email as well, and our office number is 421-6950. If you have any questions, if therapy may help you or if we can help you in any way. All right, thanks a bunch.